Hi, my name is Shelby Light, and I did my signature assignment on the Brigance screening. First, we'll talk about what the Brigance screening is. So first of all, I did my observation in preschool at Campbell Elementary with Miss Miranda. I was given the opportunity to observe her administer the Brigance screening to incoming students, and it was really an eye-opener to be able to see. I have given this assessment a couple different times, but it was really nice to kind of sit back and watch somebody else give this assessment to a student that you don't know anything about. So the Brigance screening is a preschool, kindergarten, and first grade screening, and it's available in age-specific volumes. This assessment allows you to pinpoint where each student is performance-wise based on the cutoff scores for delays in giftedness, as well as seeing where the student is developmentally compared to peers their age. This screening assessment focuses on skills that are ultimately led to school success. And the screening covers several domains that align with Common Core and learning standards, which we'll talk about those in a little bit. But the screening assessment is used in early childhood levels to assist with identifying attributes such as potential delays, giftedness, supporting referrals for services, and used for planning individual instruction. Mrs. Miranda, who I was with, told me that they mainly use this Brigance assessment to determine a child's eligibility for services and to help direct their instruction throughout the year. So I know that last year when I had given this assignment or this assessment to a student, I was able to base their needs for the year off of this assessment. But it also helped me refer them for developmentally delayed. So we were able to use this as proof that that this child needed an IEP in this area, and there was proof of scoring and what they scored low in. So this assessment is nice when it comes to having to use it to refer students for extra services within the school day. Next is what is tested. So this test covers quite a bit of things. It covers physical development, such as gross motor and fine motor, language development, such as receptive and expressive skills, academic skills and cognitive development, adaptive behavior, daily living skills, and social emotional development, such as interpersonal and self-regulatory skills. The screening asks students to perform things such as balancing on one foot, walking heel to toe, stacking X amount of blocks, drawing shapes, identifying pictures, naming pictures, and so much more. And it's intended that this assessment is to be used with children ages 0 to 7, and it provides you with standard scores, percentile rank, and age equivalents for children of the same age. All right, where is the Brigance administered? So the Brigance is typically administered at the child's school that they will be attending by either the reading specialist, the classroom teacher, or the school psychologist. Although this is a great screening assessment tool to identify incoming students who may be at risk or who might benefit from receiving intervention services, not all schools administer this screening. So I found this out while doing some research. I thought all preschools and all school districts use this assessment, but it's not a required screening, and it's an administrative decision of each school. So all the schools that I have taught at have used this screening, but I found out that some do not. So for my observation, in between administering the Brigance in my own students, I was able to observe Miss Miranda, like I had said. And as a team, it was decided for our preschool program to have parents sign up for a time to bring their child into the classroom to be screened one at a time. This just allowed the teachers to spend some one-on-one time with each of the students and really get to see what they can do and what they can't do. There are a lot of benefits for allowing the students to come into the classroom one at a time to be screened. There's less distractions. The teacher is able to really see the personality of the student. And most of the times, the child is more comfortable and less overwhelmed while taking the Brigance and being asked questions. So overall, I believe that having the screening this way is the best way to get the most accurate results. Last year, we screened each child during the school day, and we pulled them out into the hallway, and we spent probably 2 weeks screening all of the children. And they were so distracted because of people coming in and out of their classrooms, people going to the restrooms. So having them one-on-one this year with only them in the room and no distractions, I think really helped the scoring at the end. Next is administering the Brigance. So the teacher test booklet that you get with this screening tells you exactly what to say for each section of the test. I found that if you stay with the script, you will receive the most accurate results. And a lot of times if you veer from the script, your results or your scoring won't be accurate because you might have changed the wording that they needed to see if the child could understand and so on. So when scoring the child, all you have to do is circle the answers that were correct and either put a line through the incorrect answers or leave them blank. At the end, you will add up the scores and use the scoring rubric in the back of the book to see whether the child is developmentally behind or below average, right on track, which is average, or gifted and talented, which is above average. So one of the big things that I found was for you to remember that the Brigance is not an IQ test, but just a test that compares each child's results with their performance and scores of their peers of the same age. So it's kind of like a benchmark assessment to see, at this age they should be doing this, this, and this, and so you are marking whether they can or not, and that way you can go from there on getting them the help that they're going to need on their educational journey. All right, let's talk about results. So the Brigance has 11 sections that I will briefly go through, and each section is scored with so many points, and at the end you have a final total, and then you go from there. So section 1 is personal data response. This section asks the students to tell you their first name, last name, age, and address. Each correct response is worth 2 points. Section 4, color recognition. In this section, you show the students pictures of the colors listed, and they have to identify the color name. Each correct response is worth 1 point. Section 3 is picture vocabulary. The student is shown pictures of different items such as a ladder, scissors, leaf, etc., and they are to verbally identify the name of these objects. Each correct response is worth 1 point. Section 4, visually discrimination and forms in uppercase letters. So in this section, the student is asked to identify the shape or letter that is different in each row. Each correct answer is worth 1 point. Section 5 is visual motor skills. So the teacher makes a mark or draws a shape on a piece of paper, and the student is asked to mimic the mark or the shape, and each correct answer is worth 2 points. Section 6 is gross motor skills. So this is where each child you test will be able to show whether they can walk forward heel to toe, hop on one foot, and then hop on the opposite foot. Each correct answer is worth 1 point. Section 7, rote counting. Students have to count without making a mistake. So every number they can count to without a mistake is worth half a point. And that only goes up to the number 10. So there's 5 points total in that section. Section 8 identifies body parts. In this section, the teacher's naming off a body part such as shoulder, elbow, knee, foot, hand, finger, and the student has to name and point to those sections as well. And each correct response is worth 2 points. Section 9 follows verbal directions. You will see whether the student can follow 2-step directions and or 3-step directions. Each correct response is worth 3 points. Section 10, number concepts. So the teacher will call out a number listed to see if the student can hand you that many items, and each response is worth 4 points. So if you were to ask the student, if you laid out 7 bear counters, but you only needed 4, you could say, hey, can you hand me 4 bear counters? And they should be able to count and hand you only 4 and not all that you laid there. And section 11 is syntax and fluency. So this section is more of just an observation that you got from the whole assessment. So you mark whether the student's speech is understandable and whether or not they speak in complete sentences of at least 3 words. And each correct response is worth 5 points. The scoring consists of 100 points total, and when you add up the total points of correct answers, look at the scoring guide in the back of your teacher handbook and the age range of your student. So you're going to need the year and the month that they are the day of the assessment. The student that I observed was in the chronological age of 3-4 through 3-7, which means 3 years and 4 months through 3 years and 7 months. Our girl who we tested ended up scoring 38 points out of 100, so she was in the below average range. And then you can see there the ranges in the middle of the screen. Below average is 0 to 44, average is 45 points to 84 points, and above average is 85 points to 100 points. And the number ranges change based on your chronological age of your student. Because our girl was only 6 points below average, the next steps are RTI in her lowest scoring sections. Mrs. Miranda will be working with her on caller identification and rote counting and track her progress for the first 6 weeks of school. If no improvements are made, she will be tested for developmentally delayed and to see if she qualifies for an IEP and extra help or services. All right. For the standards, I was able to observe several standards that were hit through my observation. So throughout this observation, within the Kentucky IECE standards, I witnessed all of standard 4 being used. The teacher assessed and communicated learning results. She collaborated with others while assessing the development of preschool children. She also used developmentally appropriate assessment to determine needs. She actively involved parents and families. She hit all of those points. She also hit standard 6 by collaborating with colleagues and families as well as myself. She worked with others to design and implement experiences and instruction that supports the student's development and learning. For KAS standards, she hit benchmark 1.1. She maintained focus and sustained attention, or the little girl did. For benchmark 3.1, she seeked out and was engaged in a variety of experience and showed interest in everything Mrs. Miranda presented to her. The NAEYC standard, she hit standard 4, which is assessment of child progress. She used a variety of formal and informal assessment approaches. She took really good data, and she's going to use that to help better the student's learning experience. And lastly, in the CES standards, she saw standard 2, understanding and addressing each individual's developmental and learning needs, was heavily observed. 2.1, Mrs. Miranda displayed an understanding of human growth and development. And in standard 2.2, she also used her knowledge and understanding of diverse factors that influence a student's development and learning. And standard 4 was mentioned too, about using an assessment to understand the learner and the learning environment for database decision making. And here are my resources. I know that my presentation was kind of long, but I hope that you were at least able to learn a couple things. Thank you for listening and for your feedback.